So how might you know that your TMJ pain is not falling into what we might consider the normal temporomandibular pathologies and diagnoses that we might see? So some of the red flags, as we like to talk about, that might be suggestive of something not necessarily originating from the temporomandibular joint. One would be atypical angina, right? So chest-related pain. That can refer symptoms to the face, to the jaw, to the teeth, among other areas. So obviously, you'd want to be mindful if anybody had a past history of any cardiac problems or something along those lines. Next on the list would be potentially trigeminal neuralgia. Someone that might be describing sharp shooting, unilateral, meaning one-sided, lancinating, electrical type pain. It's usually very brief and very intense, but can be very debilitating when it happens. So trigeminal neuralgia could be a second red flag for you to consider. Third could be, right, it's not uncommon that people with temporomandibular disorders complain of ear-related symptoms, maybe loss of hearing, that type of thing. But if there's truly been some objective change within your ear, obviously it's wise to be seen by an ear, nose, and throat or ENT. Obviously these are rare, but people can suffer from what's called an acoustic neuroma. So that would be another red flag to consider if there are ear-related symptoms. Next, something to consider would be any type of occlusal change, meaning how your teeth come together. I tend to see this in our younger female population, but I also can see it in sometimes our older female population. And what I mean, I've seen it even as late as into their mid-60s. But if for any reason you start experiencing very sharp, intense, can be unilateral or bilateral jaw pain, but you started to notice that your bite has changed, meaning your teeth are not coming together like they used to, assuming they were relatively normal in how they approximated. Again, usually you will notice an opening on either one side anteriorly, or if both temporomandibular joints are having problems, someone will develop an opening in the front of both, upper and lower teeth. There'll be a little space where you could sneak your tongue out. And that can be a sign that there's possibly an active inflammatory and erosive situation going on one or both of your jawbones, particularly the condyle. And this could be indicative of something, could be juvenile rheumatoid arthritis if it's a young child, right? Or something known as idiopathic condylar resorption, or of course, unfortunately anything more severe than that, but certainly would be an indication to see a professional and start to get those joints imaged. Next on the list, which may seem very unusual, would be Beetlenut and or pan is something that in other countries and other cultures is used sort of like they're chewing tobacco. And that has been shown to possibly lead to changes in your oral mucosa, maybe causing lesions, and it can also be classified as a carcinogen. And one of the potential side effects of that could be a severe trismus. And what do we mean by trismus? Trismus means severe limitation of opening of 20 millimeters or less. So in general, these are people that can barely, fit their index finger in between their front teeth. So something to be mindful of. Again, just make you ask slightly more questions. There are other causes for trismus, but again, depending on the culture and the country that you're in, it is a possible indication that they're using this particular product for chewing. Another factor, indication to look for might be any swollen lymph glands or potential neck masses that you might need to be aware of. So always good to revisit where those lymph gland tissues are. Don't forget too, we have a parotid gland, we have a submandibular gland, a submental gland. These are all things we need to know where they are, be able to palpate for them, and of course, most importantly, palpate if they feel irregular on one side versus the other side. So again, that could be a red flag that there's something else brewing than a traditional temporomandibular problem. And then there's more, but one other one to just cover could be if you ever start to notice any sensory changes in your face or lack of muscle control, right? So anything that could be affecting your 5th cranial nerve, your 7th cranial nerve, or your 8th. So for example, Bell's palsy would be an example, right, where you might start to notice facial droop on one side, either your eye or your lip. That would be something to be mindful of. Any sensory changes, meaning light touch or heat or cold sensation that you might be losing on one or both sides of your face is very important. And then any potential loss of tongue control. So these are just some key red flags to consider. As I said, there's more, but these would be things that at least we have typically, not typically, but we have run into in our clinic in the course of evaluating patients.